Morning, everybody. It's good to see everybody. As folks are streaming in, first I will ask for a little bit of grace here. I don't do lives very often, so bear with me as I fumble through the tech and interact with everybody, hopefully. This is a new thing for me, so asking for a little bit of grace. As I'm looking around, I'm like, ooh, I probably should use a little bit more light. So again, as I do this more often, I'll get a little bit better, hopefully. And if someone's out there who's super tech savvy, reach out to me, help me, right? I'm okay with taking some tutelage. I'm okay with that. So maybe I'll just introduce myself for those that don't know me and haven't been following me. My name is Dr. Dunbar. My first name is Siata. I'm a family medicine physician. I'm also board certified in lifestyle medicine as well as sports medicine. It basically means I love to learn, and I continue to sort of evolve as a physician, and I evolve in how I want to take care of my patients. You know, what are the tools that I want to have to make sure that I'm doing a good job and make sure that I have the knowledge to support my patients as they need. So after my family medicine training, I went and did sports medicine because I love being active and I wanted to have that skill set. And then most recently, I've gotten a board certification in lifestyle medicine because a lot of what we know in healthcare is, 80-90% of what we treat is preventable and in some cases reversible if we can educate one and then support people in making some significant lifestyle changes. So I wanted to make sure that I had the tools and the understanding and the knowledge to do that. And that kind of brings me to where I am today, where I'm finding, again, through personal walk, this menopausal transition is an area where I want to spend my time and effort and, be able to provide support again. So that's why I'm doing this, right? I spend the time to educate myself and bring this forward to other folks. So thank you for joining. I see some folks streaming in. Hello, how are you? So right now I have a private practice. It's called Ceravit Direct Health. It's also on Instagram. You can feel free to follow me there as well. And my goal with doing that private practice was to just be more available, right? Traditional healthcare docs are kind of buried behind all the staff, takes forever to get to us, whether it's an appointment or just a message. So the private practice is really structured to make sure I'm accessible. I can see my patients quickly. I spend, an hour with them if need be. That's not an uncommon visit. And we can unwind the stuff, right? All the things. Make sure you can get to me when things are a concern. So if you are in Portland, you're looking for a doc, or you want a very different healthcare experience, I would love to chat with you. Feel free to reach out. So my goal with this is on a weekly basis, on Thursdays at 10, I'll pop on and I'll do a live. The goal is we're going to talk about menopause, right? So it's titled Menopause, and there is a laundry list of symptoms that come with menopause. And the goal is really not just, again, for me to come and preach, but hopefully to be interactive. So I hope if we have comments, questions, those sorts of things, please don't hesitate. Put them in the chat. Let's create an open dialogue. Let's support each other. And like I said in my video the other day, if this doesn't end up being the right format, then we'll figure it out, right? We'll create something else that allows us to have this community of folks that are walking this together, and we can support each other and make sure that this is a transition that is that we can still thrive through. I mean, we spend more of our life on the back end of menopause for the most case, or at least a significant amount of it. So we should spend some time, right, figuring out how to make sure that that's a high quality and it's a vital life. So that's my goal. So today my goal was to talk about menopause and vasomotor symptoms. And vasomotor symptoms are kind of a cluster. There's two of them. There's night sweats, and then there's hot flashes. And hot flash, I was reading a book, and the author, she prefers to call it a hot flush, just because flash gives it a sense that it's just this fleeting thing, right? Which it's not. It can last, 5 minutes or more. It kind of comes on and it just sort of like overtakes you. So however you describe it, but the total term is called vasomotor symptoms, and they encompass sort of that temperature dysregulation that happens, and when it happens at night, those are called night sweats. So thank you for those that just joined. Candy, how are you? And then Arnold, I think that's his name. So again, my goal is for this to be interactive. So please, if you have questions, pop them in the comment. I think I can manage that at the same time. What I said in the beginning was give me a little grace. Lives are new to me, so I'm trying to step out of my comfort zone a little bit. So, but if you have questions, shoot them in there, or suggestions for folks. Don't be shy. So again, vasomotor, kind of night sweats, and hot flashes. So what happens is at least an understanding of, I'm doing great, Candy, thank you. Just a little bit of sort of medicine or physiology, and I don't want to spend a whole lot of time preaching. So, but just a little bit of understanding. So what happens is, our hypothalamus, which is deep in our brain, it's about the size of an almond. That's what controls like thermal regulation. That's what tells us, I'm hot, I'm cold, those sorts of things. And what happens during menopause when it's not that there's estrogen or no estrogen, it's how quickly we lose the estrogen. So when there's this decline in estrogen, then there's a lack of control of that thermoregulatory system. So if you think about it, like, let's say that thermal regulatory system was like a smoke alarm, and estrogen is like the adult in the house, right? The kind of calm homeowner. And the smoke alarm is going off saying fire, fire, fire. And estrogen's job is to say, hold on a second, maybe that's just burnt toast. So let's not get too excited. And when there's a lack of estrogen, when there's a deep decline in that estrogen, then there's no checkpoint, there's no regulation of that response. So from a very sort of minor temperature change, again, that smoke alarm perceives that as something significant, right? And then all of a sudden it sort of just like takes over, right? It's sort of like your chest, your neck, your head, and you feel like something's gonna explode through the top of your head. So I'm right there with you. And estrogen is not there to say, hold on a second, it's not that bad, this is just burnt toast, and it can sort of take over our whole existence. I don't know if anyone is experiencing, hot flashes or night sweats. If you are, put whatever emoji in the comments fits you for this. If I could do this and talk at the same time, I put the fire, because it does feel like that, right? There's this overwhelming heat that just sort of takes over you during these episodes. And when this happens at night, those are called night sweats, right? And you wake up completely soaked, you're tossing the covers off of you, you're drenched, it disturbs your sleep. Sleep is so vital, and when we start to lose sleep or get sort of broken sleep, that can have some pretty significant consequences as well. So those night sweats and those hot flashes are really about how quickly we lose our estrogen. And if we can think about menopause, and maybe I'll do a little bit of terminology so we're all kind of on the same page. So perimenopause is this period where we start to develop some of these symptoms. Typically or conventionally, some may think that, night sweats only happen once you hit menopause, and that's not true. There are probably 4 different categories, right? Up to 80% of women in general are going to have night sweats. Then you say within that 80%, there's about a quarter of each kind, right? One is they can get them really early in perimenopause. Then others will get them later. Others will not have any at all. And then some will get them after menopause. So there's really a mixed bag, and we don't know who's going to fit in that bucket, but you can absolutely have night sweats, and you can absolutely have hot flashes or hot flush or those sorts of things in perimenopause. We've got some other folks joining in. Hi, how are you? So perimenopause is that period before menopause, and that can last years. usually 40, 45 is on average when we start to experience some of those perimenopausal symptoms. That chunk of time can also be considered that menopausal transition. And it's a long time period. And then menopause is like one specific period of time. It's when you haven't had a period for a year, then we can say, boom, now you are menopausal or you are in menopause. And then anything beyond that point is called postmenopause. So during that menopausal transition, we can start to have symptoms. And again, depending on what quarter, right, 25% of that you're in, it could be really early in perimenopause, it can be later, or it could be after menopause. And some are blessed to not have them, sadly. That's not my case. So it just depends. So I think I say that to say, if you're finding that you're going to your doc and you're having symptoms and you're in your early 40s and they're kind of dismissing you and saying, oh well, we don't, that can't be it because hot flashes don't happen until after menopause, I would encourage you and I would support you in staying vigilant in your sort of desire to get tested, and you don't have to get tested, so let me back up, but your desire to look at treatment options or to start having that conversation. And maybe I'll do a live on how to have that conversation, what to ask as far as how to have those discussions with your provider. But you can start having these symptoms early in your 40s, so you're not crazy if you're having this. Don't feel like that's out of the realm of possibility. So as you get these right, it's like, oh my gosh, you feel like you're gonna boil and you're like, taking the layers off and the whole bit. Then what happens is the body sort of vasodilates, right? So all your blood vessels kind of open up and expand, and that pushes all this blood to the surface of your skin to try to cool you off. And then that's when some of us will go way on the other end and you start to do the chills and the shivers and all that, right? So you go from super hot, your body is rapidly trying to cool you, and you get the shakes and the shivers. And that can happen once a day. It can happen 10 times a day. It can, it's just, it's so unpredictable. And I think that's why it can be so distressing, and it can cause a lot of anxiety. It can cause a lot of stress for people when we're going through, all of these symptoms. And that's just one of them, right? Hi to the folks that are still coming in. Erica, it's nice to see you. So it's a very distressing time. And during those episodes, your heart rate goes up. You're sweating because now it sort of sends a signal to your sweat glands. You can get anxious. It decreases the blood flow to your brain during these periods of time. So there's a whole host of systemic symptoms that happen as a result of these hot flashes. As far as, who's at risk or when do you get them, who's more prone to these, we do know that African Americans will tend to have more severe symptoms. Caffeine will make them more severe. Alcohol will make them more severe. The other thing is if we've had any childhood sort of trauma or abuse, it changes our brain chemistry, right? We know this for a fact. And that change in brain chemistry, we don't quite understand it, but we see sort of a correlation between more severe symptoms and those that have had childhood trauma and abuse. And again, African Americans will suffer more significant symptoms. We also know that more severe symptoms also carry an increased risk for heart disease and stroke. So this is another reason why, especially in the African American community, I really want people to stay vigilant with their providers to make sure you're doing the appropriate screening, right? Are you getting regular blood pressure checks? Is someone talking to you about your family history of heart disease and family history of stroke? Do we need to do more significant lab work than just the typical cholesterol panel, which for sure everyone should be getting, but do we need to dig a little bit deeper? Those were some of the reasons I also started my private practice, because it allows me to spend that time and do more work to really help people understand their risk factors. But those that are having more significant, symptoms with night sweats and hot flashes should definitely make sure they're staying up on their screening for cardiovascular health, right? What's your metabolic health like? Do you have pre-diabetes? Those are all things that are going to sort of compound your risk going forward as you get wiser in your years. So those are the things that for sure stay up on screening. And again, who's at greater risk with these symptoms. So again, super unpredictable. Don't know when it's going to come. It can be super distressing, can cause anxiety. The other thing we find is those that have pre-existing anxiety will also have potentially increased symptoms. Hi, Dr. Ethel King. It's nice to see you. So just being vigilant, right, with testing. The other thing that's important too is ruling out other causes. So when we talk about menopausal symptoms in general, it's also super important, again, stay in touch with your doc because we need to make sure we're not missing something else. So other things that could be causing these vasomotor symptoms, thyroid disease, diabetes, those two for sure. We think about night sweats, cancer potentially. And I don't say this to scare people, but this is why it's so critically important to have a doc that you can work with, right? That knows your risks, that knows your history, and can spend the time with you to make sure that we're not missing something. And we're not just saying, on the one hand, I feel like women are kind of poo-poo and say, it's just being a woman, it'll eventually end, and we're not given the time and attention we deserve. Or, oh, well, that's menopause, don't worry about that, it'll go away, and we're not testing for other things, right? So thyroid, diabetes, sleep apnea is another one. Making sure we're not missing sleep apnea. The night sweats will definitely disrupt your sleep. And again, sleep apnea can carry a risk for heart disease, can carry a risk for high blood pressure. So making sure we're staying vigilant with screening for sleep apnea. Underlying anxiety, again, are we making sure that we're screening for that? Hi, Mika, thank you for joining. And then medication side effects, that's another one. Are we taking meds right now that could be causing some of these symptoms? So we just have to please stay vigilant, stay in touch with your doc, and make sure that they're screening you for those things. Alcohol use is another big one. Alcohol is a tricky thing. We've said for a long time, we medical community, that 1 or 2 drinks is probably okay. You'll hear people say, red wine's good for your heart. The Mediterranean diet says that, 1 glass of wine is a good thing. We are finding now that alcohol truly is toxic in any quantity. And, maybe 1 glass of wine can help with some symptoms, or 1 glass of something, but then beyond that, it leads to really disrupted sleep. It can significantly change the severity of your symptoms. So alcohol is a risky substance, not to mention its risk for cancer. And I tell people all the time, it's not what you do on the big events, right? The birthday, the holiday, it's what you do the rest of the year. So 1 glass now and again it's not a deal breaker, but it's what we're doing consistently that really defines our health. So I've talked a lot. Are there questions, comments, feedback? Are people out there struggling, and what have they find? Have you found things that work? Before I kind of go into some treatment options that are at least, current mainstay, but I would love to hear, any comments from anybody else. I think they should come across. So I'll just give some time, or even where you're joining from. I'd love to know that. So if people don't mind just popping in, what city they're in, or what state if they're not in Oregon. I'd love to know that too. So I'll give everybody a couple minutes. I know I've got some local folks here in Portland with me, so thank you for joining. I appreciate that. All right, so again, let's see if I can. All right, so I've got a question about, can perimenopause cause digestion issues? So let's go into that a little bit. So yes is the short answer. And again, when we think about, perimenopause, or that menopausal transition, and that's the time before you hit menopause. And then menopause again is no period for a year, and then we say boom, that's menopause, and then anything beyond that is postmenopausal. So all throughout that menopausal transition, and that can start 40, 45, some people even get it earlier than that, right, which is considered early menopause, premature menopause, and there's a whole different treatment, sort of, I won't say whole different, but it's just, you want to be treated in those cases, right? Because again, you have that lack of estrogen for such a long period of time, which has some pretty big consequences. So we want to make sure that we're treating folks who've gone into premature menopause. So during all of that, we have varying amounts of estrogen and progesterone. So those hormones, if you think about it, when we're all menstruating, right? Let's go way back when we were, puberty. Think about all the symptoms we get when we're menstruating, right? We get bloating, we get all of these sort of GI type symptoms. Well, all we're doing is we're taking that and we're moving it further down the continuum. So now we have this loss of estrogen and this loss of progesterone. So we're going to have very similar, we will have some GI symptoms as a result in that drop in those hormones. So yes, we can have GI symptoms with perimenopause, even into and beyond menopause. So yes, for sure, we can have that. And we can spend a whole lot of time just talking about GI and one of the other topics too. So let's see, I'm going to look for, I think I got a couple more questions. So hang on. So there's a question about hormone supplements and do you recommend any herbal supplements? And this is where it gets hard as a doc, right? So my brain is very like, okay, what does the science say? And, where's the evidence? At least right now, so there's one called black cohosh, and there's some evening primrose. So those are definitely out there. And anecdotally, folks can have some symptom relief. When we stack it in studies, we don't see that there's a direct benefit. But I will tell you that there's a whole thing called placebo, and even if anecdotally it helps, I think the big thing I would say is, again, making sure you're working with the physician, because some of these things can interact with other medications. So if you're on other medications, just understanding if there's risks with these herbal supplements, or plant-based or those sorts of things, with other medications you're taking. So I don't personally, again, because the evidence isn't necessarily there yet, but if someone comes to me and they're taking it and they're finding relief, then my job is to make sure it's not doing them any harm. Looking at their meds, looking at their other history, again, make sure I've ruled out other things. And if that's the case and they're finding relief and I don't find any interactions with other medication, I don't think there's a problem using that. So it's really, again, making sure somebody's watching the store and treating you as an individual. So hopefully that answered your question. Anything else? Any other questions? Let me just look really quick. All right, good. Any other questions? And then I'll roll into sort of treatment again, as far as we have right now for, again, just this particular symptom, right? Vasomotor symptoms. And each week we'll go into a different topic. But just for this particular symptom related to perimenopause or this menopausal transition and then beyond menopause. Any other questions? Is everybody here in Oregon? Is there anyone outside of Oregon logged on right now? If you are, just like wave or tell me where you're coming from. I'd love to know if there's folks outside of Oregon. Our beautiful state with our rain falling. All right. Okay. So let's go on. So treatment. One potential option is cognitive behavioral therapy. And the reason for that is to start to try to rewire the brain's sort of perception or how we respond to these symptoms. And it's not in any way to say that these symptoms aren't real and, this is like some voodoo stuff, but the brain is a powerful thing, because what we say to ourselves, our brain believes, right? It doesn't really understand reality versus other. So the things we speak and the things we utter, our brain starts to believe. And that is, it can be used in any other area of our life, right? Sort of positive affirmations we talk about, right? And if there's anybody on here who uses this, right, speaks good into their life, speaks, reflects on, the positive things, and does gratitude exercises, all of that is to rewire your brain, right? The things we speak into existence, our brain starts to believe us. So when it comes to this particular topic, and even I struggle with this, right? You feel it coming. I mean, it's coming before it's like full blown, and being able to think about it a little bit differently and be able to, as opposed to this is never going to end, and this is the worst thing in my life, and all those things, trying to think about it a little bit differently, using a different type of language to start to rewire the brain and its perception of what you're going through can be a powerful thing. And so cognitive behavioral therapy is helping us to develop the tools to start to rewire the brain. And I will tell you, using it in other areas can be really, really powerful. Let's see. Yeah, absolutely, Mika. Yes. I mean, this time is distressing, right? And it can cause a lot of mood disorders, a lot of distress for people, and being able to control, or at least change how we perceive this part of our life, can be so powerful and so freeing. It takes time. Yeah, for sure. There's a lot of anxiety that comes with this period of time. And I think some of it is because we don't talk about it enough, right? And a lot of women, I think, are just kind of in their little silos. Maybe they've got a few girlfriends, or maybe their mom talked about it with them, or their aunt, and they've got a few people, but we're all just kind of in little silos by ourselves, which is part of why I really wanted to try to do this, right? To say, one, let's just talk about it, and let's try to create a community around it so that we can lean on each other. Because sometimes somebody has a little tip or trick that's worked for them. And again, as long as it's not causing harm, then why not, right? So there are a lot of things that we do. Medicine takes time to sort of say, are there studies, are there evidence? And that can take years, but other folks are using some anecdotal things that are really powerful. So cognitive behavioral therapy for sure is one particular option, and that's something you can discuss with your regular doc. And then you've got hormone therapy. And maybe I'll spend a little bit of time on again, just terminology, and I will probably be guilty of this, so you can remind me when I do it. But so hormone replacement therapy, typically we think about it if somebody, let's say, has premature menopause, right? So when they should have, there's a particular time in their life where we feel like, ooh, you should have, enough estrogen and enough progesterone around, and we're having to replace what should naturally be there. That is called hormone replacement therapy. Then we've got hormone therapy, again, doing this perimenopause, into menopause, and post, where we expect, right, this is normal. We expect this to happen. That's hormone therapy as opposed to replacement. It's somewhat semantics, but I will probably use it interchangeably, but if you hear someone say hormone therapy versus HRT, hormone replacement therapy, they're likely talking about the same thing. But if you want to really split hairs, right, replacement is at a time when you should normally have it versus in this period of our life where we expect to see that decline. It's hormone therapy. So the mainstay would be estrogen. Again, in the very beginning, we were talking about how, the gatekeeper for our thermoregulatory system, which sits in our hypothalamus, is estrogen. And it's not just the presence, it's how quickly you lose it. And when estrogen drops and it's not there to tell the hypothalamus, oh, this is just a minor thing, it kind of throws the whole thermoregulatory system off. And as a result of that, something that's just a mild temperature change is perceived as, right, and it's like, oh my God, it's going to come through your head. You're just like overwhelmed by this immense amount of heat. So giving folks estrogen can help to sort of regulate or to come in and be that gatekeeper for that thermoregulatory system. Start low and then titrate up or increase your dose for symptom relief. I will say, if you still have a uterus and you've not had a hysterectomy, you will also need some progesterone. And again, working with a doc who can dose this stuff for you, get you on the right dose, whether it's a patch or a pill, combination if you need it with progesterone, depending on your unique situation, super, super important. Again, the first thing is just, hey, I'm having symptoms. And then working with somebody who's going to listen to you and help you navigate those things together. So there's hormone therapy. Then there's non-hormonal therapy. So options are antidepressants are one option. Again, because of sort of their mechanism of action, to control vasomotor. And then another medication potential is something called gabapentin. That's another option. Again, evidence has shown those two medications probably have the most benefit and show to be the most helpful. So antidepressants, gabapentin, and then there's another non-hormonal medication, Veoza, that's now on the market for vasomotor system symptoms and menopause, right? Just as a bucket, but really it's perimenopause and menopause and throughout. So that's another option for non-hormonal therapy. And again, it's a function of working with your doc and figuring out what's going to be the right option. Hi, I just saw her join in. Oh my gosh, this is a blast from the past. It's good to see you, Lucinda. Those are sort of non-hormonal options for night sweats or vasomotor symptoms. What other questions? Okay, what if someone doesn't do hormonal therapy? Meaning your your physician doesn't prescribe it, or the patient desires not to have hormone therapy in general. Okay. So maybe I'll take the first one. Let's say you're seeing your doc and your doc is not comfortable, or they don't, I think, this is so hard. If you're seeing your doc and you're talking about your symptoms and either they're saying, you know what, I don't think this is real, or, oh, this is just normal, you just got to kind of muddle through, then I would say looking for a physician maybe that is comfortable doing hormonal therapy, and there's a way to, if you need help, I can help you find that. Now, if it's the patient who says, I don't want hormones, then you're looking at your non-hormonal options. So again, antidepressants, and these are medications, and then we can go through some other things. So antidepressants, gabapentin, there's another medication, that Veoza. Again, we talked a little bit about herbals, so black cohosh, evening primrose. Those are some non-hormonal options. There's CBT. And then there's, for sure, and I haven't even touched on this, and as a lifestyle medicine doc, there's a whole host of things you can do from a lifestyle perspective to sort of do our best to manage our hormones. So what we choose to eat, right? If we're eating really highly processed, highly sugary foods, I would tell people to try to peel back on those sorts of things. Alcohol consumption, peel back on that. If you're a smoker, that can also worsen things. Caffeine, that can also worsen your symptoms. So there's a whole host of lifestyle, nutrition, and exercise that we can talk a lot about to manage some of these vasomotor symptoms, in addition to non-hormonal therapy, whether that's CBT or medication. Hopefully that answered your question, Mika. If it didn't, pop another thing in there for me. So alcohol, caffeine. Caffeine, saw a good benefit with caffeine. And, so I will, a little bit of confession. I'm not Catholic, but we'll do a little confession. So I know caffeine bothers me. I know it does. Really hot liquids is what I've discovered, at least for me. So I went on this 2-week where I stopped drinking coffee in an attempt, and I didn't see a significant improvement, maybe a little bit better. And again, it came down to, risk what was the potential benefit on the back end of not having the coffee, versus I just really enjoy my coffee in the morning. It just is like how I start my day. I have my coffee. I'm usually the one that walks the dog in the morning, and it's just like, it's how I get my head right. It's just my little piece of, something in the world. So I just decided, you know what, I'm going to have my coffee, and I deal with the consequences of that. And everybody has their thing, right? And for me, even hot tea was still bothering me. So I didn't have a great alternative that would really completely reduce the symptoms. So I still do my 1 cup of coffee. So I'm not ready yet to let go of my coffee. How about that? I'll put it that way. I have a growth mindset. Not yet. Yeah. Anybody else? Any other comments, questions? Was this helpful? Can I just get some sort of feedback? If it's helpful, and then I'd love to know if folks want more, want less, more medicine, less science. I see some hearts, so I'll take that as a thumbs up. Perfect. Okay, good. So my goal next week was to talk about sleep, because it ties into these vasomotor symptoms and night sweats. Is there another topic that's super pressing? Anybody else want to say, oh no, doc, talk about this instead? If there is, pop that in, and I can certainly shift gears. If not, the goal will be next week we'll talk about sleep. Anybody else got anything pressing they want me to? No? Thank you for the hearts. I appreciate that. Thank you. Thank you so much for folks that joined. I really do appreciate it. And if it's helpful, tell your friends. They can certainly follow me. Again, Thursdays at 10, I'll come on and talk. And if folks have questions, I'm here in Portland. And again, if you're looking for a doc, I'd be happy to take care of you. You can find me, either send me a message through here, or my Instagram page for my office is Ceravit Direct Health. You can also Google that. And I offer free meet and greets, a quick little conversation to see if it's a good fit. Okay, so I don't see any other pressing topics that folks want me to discuss next week. So then I'll stick with sleep. So we'll talk about menopause and sleep, or sleep disturbance, next week, Thursday at 10 o'clock. Alrighty? Thank you everybody for joining. I really do appreciate it. Have a fantastic day. Take care. Bye-bye.